Okay, we are recording very well. So, again, thank you for coming today. And I already explained to you the topics we're going to cover. So, let's get started with the presentation. So, low register versus high register medical terms. So, before we get into the medical technicalities, let's talk about what is register. So, this definition that we have here is the variety of language used for a particular purpose or communicative situation. So it is the way, the style of speaking of a person, their tone, their style of speaking. So we know that everyone knows here that we speak differently depending to of the person we are talking to. So if we're talking to our parents, coworkers, siblings, it's always different. And just to tell you something, there are some things that are going to be like very, very obvious for you, but you have to find a way to apply it to interpretation. So it has to be really, really clear if you want to do interpreting, a very good interpreting. So we use a different register for each person we talk to and in the situation we are at. So we do this sometimes without even thinking about it, without even realizing that we are changing our registers. So as an interpreter, you have to be conscious about that because you want your interpretation to have the best quality possible, to have the best, to be able of not only translating words, but meanings that people can feel like they're getting to know each other. And we will see why register is so important for that. And we have to think about register as a spectrum. We know there is high register, low register, colloquial slang, but so some words cannot be really classified in each one of these boxes because it's like some things are more formal and less formal. So it is like a spectrum of, of different, like a scale of formality that we are talking about here. So why is register important for interpreters? And again, this image, obviously you're not going to interpret the same way you are in a bar or with friends if you are in a conference. Even medical and legal, the style of interpretation, the register is completely different. And why is register important for interpreters? We have to, one of our standards of practice is accuracy. And accuracy is being able to convey all that the speaker says without omitting, adding, embellishing, editing, or changing anything about the message. It has to be just as it is, completely transparent. So they, part of the accuracy is that the interpreter replicates the register, style, and tone of the speaker. So this is according to the, excuse me, I have some people on this side. Okay, we have, this is according to the National Council of Interpreting in Healthcare. So this is one of the standards that all interpreters must abide to. And also, uh, as an interpreter, we have to be conduits. But again, about register, if we change the meaning, for example, if the doctor says something, let me give you an example. If a patient says, this doctor is a jackass, and you say, oh, the patient doesn't really like you, doctor, you are not being accurate. You are changing the register because he used jackass, which is a pretty offensive word, and you have to say it that same way. You cannot say like something to make it sound better or more polite. It has to be just as it is. And also, if the patient says the back of my head hurts, and you say the patient's cranium is incapacitating him, it sounds much more formal, and that's not what the patient says. So you have to say that in the same style. You cannot try to make them sound more intelligent, more agreeable, or anything. And also register is important because for example, if we talk about the name of the doctors, the ophthalmologist, this is a word that most people sometimes don't even remember, equally with the ear, nose, and throat doctor, which is the otorhinolaryngologist. So people don't want to say this whole word, and they say the eye doctor, the ENT doctor, and that they are changing the register so it's more easy to understand. The same happens with hypertension and high blood pressure, or neurodegenerative disease and a brain disease. So you really have to be familiar with register both from both sides. There is a message in the chat. 1 2 hours is this meeting is going to be until 4 p.m., which is 3 hours, but I hope that by 1 hour um, we're going to start to practice, I hope. Yes. So yeah, continuing. How are messages and meaning affected by register? You can have an idea already. So again, it's not the same talking to your sister in your dining or in your kitchen or eating or whatever than talking in mass, in church. Completely different. You have to adapt to the context, to the environment you're at. And the way that, as I mentioned before, you register affects understanding. It's not the same saying take your hydrochlorothiazide twice a day than saying take your water pill twice a day, and you should keep the same register. So sometimes some interpreters, they feel like the urge to simplify things because they feel that the client is not, or the patient is not understanding what the doctor is saying. So they change the register and only the interpreter knows, because the other person of course doesn't speak Spanish or the other language, and everyone is happy, but you weren't complying um, with that standard of practice of really being accurate with what you're saying. So can somebody tell me, how do you say water pill, but in medical terms? What is a water pill? Maybe you can say it in the chat. It can be in English as well. Mode of communication.
Diuretic, isn't it?
Yes, diuretic. That's it. Yes, that's correct. So diuretic is the right term, but people say, oh, your water pill, or and so on. Yes, the mode of communication and tone of communication are really effective. Yes, and I'm going to also explain to you why.
Sobre interpretación en términos médicos, en medicina y en área legal.
Yes, certainly, yes. It's the style and the tone, yes. So the speaker's attitude and personality traits. The way you want to give an accurate representation of the patient's personality through their speech. This is especially important in mental health and in counseling, in therapy, because sometimes people can communicate with so much emotion to their words, and you want to represent those words accurately. And by the way someone speaks, you can tell whether or not they are friendly or less friendly, warm, distant, educated or uneducated, polite and polite, respectful and disrespectful. So you want to, by keeping the same register, you are being transparent with how the style of speaking of that person, which is ultimately part of that person's personality. And these words can be used to give a good or a bad impression about someone. And you want to give just the exact impression that that person will have in their own language if they say something a certain way. So the register is also important because you want to, like I just mentioned, you want to cause the same impact or the same impression that that person will cause if they say something with a certain style, or if they say something rude or say something really nice, a compliment, complaints, praise, apologies, blaming, thanking, informing, etc. So you really want to think about what's the purpose of this person saying this thing? Why what impression they want to cause, what they want the other person to do, and what resources as in matter of their about their style, what resources, stylistic resources they are using to express that, to get a response. So another example, interpreter, you can tell him to show his opinion of his ass. And you cannot say, oh, she doesn't care about your opinion, because again, it is going to be problematic. For example, I had this call with a Latina woman who was constantly calling the person sweetheart. Oh, sweetheart, oh, love, oh. So it was an MTA, it was a lady from the New York City transportation. And she was like, don't call me this way. You cannot call me this way. And so I could have avoided all the times that she mentioned, oh, sweetheart, oh, love. And she probably wouldn't have gotten angry, but you have to convey those things, because if you decide to edit or change something, what happens if instead of taking it a bad way, this naming of a sweetheart, she will have felt like, oh, that's really nice. But it's not up to you to decide whether or not she's going to feel nice or not. You just have to say the message. You are the messenger, that's why you're there. So also these are also another example. If a patient says, my back hurts like hell, this is not the same as saying my back hurts a lot, although it means the same, but it's not said the same way. So even with the small changes of communication, of intensity, of register, even with the slightest one, you can see that a difference there is a difference in the communication flow. So you want to really keep the same registers so you can give both parties the opportunity of having a transparent communication, and especially in patient-doctor encounters, to really get to know each other transparently. So what skills related to register should interpreters have? So here I have a Sheldon Cooper, and I have what it seems like probably a homeless person. So why I have a Sheldon Cooper in here? So you know that if you have seen the Big Bang Theory, Sheldon always talks to everyone with a very high register and very formally. He addresses everyone the same way. And sometimes people do not understand him, or he seems to be like out of place. Like if you are at the supermarket and you're talking to the cashier or something about something that you can say in very simple words, but you say very elegant and complicatedly, you're going to be like a Sheldon Cooper. Like Sheldon Cooper is stuck in his register. So you don't want to be a Sheldon Cooper, and you want to be able to adapt to different registers, to different contexts. And in medicine, this context could be in the emergency room, in a very calm conversation with the patient and the doctor in the doctor's office, or maybe in a therapy session where they start to cry, or they start to, you have to be flexible, and you have to switch back and forth between one register and another. And here below we have what it seems to be like a homeless person. And this is interesting because there have been studies suggesting that people living in poverty are more likely to get stuck in one register, because they don't develop the other registers. They don't know it because they don't have that education, or they refuse to use higher registers because it feels inauthentic. It feels vain and arrogant to speak that way. In my country, for example, if you speak very well, if you're very polite and well mannered, or if you are like, you use very words that show that you have some educations, if you're like that, like in the hoods or something, people is going to think, oh, this person is so arrogant. She wants to show that she knows everything. So I mentioned this because these are the kind of people who are stuck in register, and you don't want to be like them. You want to adapt. So what skills, like I said before, don't embellish or simplify the speaker's words, interpret words as they are, and considering cultural and linguistic aspects. Sometimes what you say in one language can be offensive in the other language. But it's like sometimes something sounds offensive if you translate it as it is. But if you think about it, that in the source language, this is not really offensive, then maybe that's something that you should consider to see which interpretation is better for you to use. You want to be accurate in meaning. So you have also, besides being able to adapt and switch like a chameleon, you have to be able to know the high register, low register, and slang version of words or phrases like belly button, navel, and umbilical cord, because you're going to use all those. The patient usually has a lower register than the doctor, so you have to be familiar. And also you get across some people who just speak in a way that they use so many idioms and they are so expressive in a way that is, it's really a slang and colloquial, but it's really interesting because you see them expressing themselves that way, and you want to showcase that, like that, how we say in español, ese sazón, like the flavor of the person's words. So now that we know why register is important for interpreters, let's deepen our knowledge about the types of register, and then we will do some practice exercises. So here, I have a photo of a man playing the guitar, and I just want to mention that this because even if you know what is register, if you know which types of registers they are, if you're unable to apply it in real time, then it's like you really don't know. So you really have to put it to practice. Because as when you are in a live assignment, sometimes all these things of everything is fast paced, because it feels fast paced for the interpreter because you have to be taking notes, listening, and then thinking about what you're going to say next. So it's really a lot of work, even though both people are just really calmly just talking. It reminds me of like the interpreter is like a duck. On the surface, it looks like the duck is very calm and quiet, but below the surface, it's just trying to get afloat. So yes, so these are the types of register according to Martin Just scale, formality scale. Remember that register is a scale, like a spectrum from formal to informal. And Martin Just was a German linguist of the 20th century. And we have frozen or static register. And these are the type of register that do not changes over time, that is repeated by rote. Like in legal assignments, like when they say, do you swear by the truth? Do you swear to say the truth? Nothing but the truth. I swear to God. I'm not familiar with that, but you know what I'm talking about here. That is sworn testimony, the pledge of allegiance, biblical quotations. Those are the kind of frozen, like things that are just repeated over and over again. And there are the archaisms. These are the words that are very old-fashioned, very outdated language. For example, the other day, well, not the other day, a while time, some time ago, there was a lady. She was an old lady, and she told me a word which means like to hit something, to get hurt by hitting yourself accidentally, and she used aporrear, and this is a very this is a word that I have never I know the meaning of that word. I have heard it before, but at that time I couldn't. What is this? Huh? A red line. Okay. Anyways, so at that time when she told me that, I was thinking, what does she mean? Because it was such an outdated way of saying that you got hit against something, and I had to ask her, and then she told me, oh, this, and I was like, oh, of course it is that, but it's just such an old word that no people, like young people, doesn't use do not use that word anymore. So some examples of archaisms, there is thou, formal you. English, believe it or not, used to have like different pronouns for addressing formally and informally. Like in Spanish, we have tu. In French, we have tu and vous. and in Spanish we have tú e usted. So yeah, if you want, if you don't believe me, searches. It is in Romeo and Juliet in the 1300s. This is Middle English. So another example, cleanse to restore health, and this is really interesting because in Spanish, cleanse, we say hacerse una limpia, and this is like folk medicine when they grab like a leaf or an egg and they rub it in on your whole body, and that's supposed to clean all the evil that or all the bad health or anything that you have. And we say that. And another thing is recipe. Before, recipe was a medical prescription, and in Spanish we still say literally, a literal translation of medical prescription in Spanish is recipe. We still use that word, which is really interesting. And I want to send you this link of archaic words. Of course, you don't have to learn all of this, but it's really interesting, just some general education. So maybe when a lady says, like she did, like aporrear, you will not be as lost, but it almost never happens either way. And I will send it to you. It will get you will become familiar with that. Okay? Okay, very well. So another type of register is the formal register. And I'm just wondering, can't you see that red line in there? Did you see like a red line?
Yeah, it is there.
Yes.
You can go like to the options of the meeting and you can like disable annotations from participants just in case.
Oh, I don't know how to do that. Oh, where? But is it bothering you a lot? Because I think it's going to take me some time
No,
to find. Okay.
no, it
Yeah.
doesn't bother. That's fine.
Okay. Oh, please. It doesn't bother me, but please do not take notes on the slides, please, okay, because I don't know how to erase it. So Yasmin, that's exactly what I was thinking of as a native Spanish speaker about receta. Yes, and you will see there are many much more interesting facts that maybe you don't know. So, and in the formality scale, remember we are going a scale from a very, very formal to less formal. So in the formal scale, in the formal register, there is a tendency to use more words of Latin and Greek origin. So for example, if they tell you breastbone, that's like the informal version of sternum. Most people if you say sternum, this is like in English at least, it's a language that is used more among doctors and medical professionals, right? But you say breastbone and sternum, but in Spanish, we have esternón. And this is the way we can say el hueso del pecho, like the chest bone. We can say that, but we can say sternum, like closer to the Latin word. And it doesn't look informal, it's just the way we name things. And I think the same thing happens with French. It's in English, words that are more closer to French, to Spanish, in other words, to Latin and Greek, they are more formal. The same with trachea, windpipe, scapula, and shoulder blade. It's really something interesting. We use formula here in Colombia, formula for medical prescription.
Yeah.
Yeah, we use receta recipe for foods and for, yes, that's right. So formal, there is more technical vocabulary, there are acronyms. So there is a tendency in the formal language that there are a group of words that act as a noun, and these are noun phrases. For example, implantable cardioverter defibrillator. This is a very long word, and it acts like as one single subject, like one single noun. So it would say ICD, which is the abbreviation. Another example, coronary artery bypass graft, a very long, and it acts like a single noun altogether. Is the abbreviation, the acronym is CABG, or continuous positive airway pressure, CPAP. just a machine that people use for sleep apnea. So this is a tendency used in informal register. And there is in Spanish, and depending on the language, because there are some languages that use more acronyms and some languages that don't. So in Spanish, we do not use acronyms as much. So it's believed, at least most translator interpreters believe, that we should expand the acronym if we know it. Because if you say the acronym, people is not going to understand either way, because we don't use acronyms at all. And maybe I've heard that some in Spain, there are some, I have heard commentaries that people use it more down up there, but we say we leave we either expand the acronym or we leave the acronym as it is, and we say por sus siglas en inglés, by its English initials or something like that. Let me see, there is commenting in the chat again. I'm Arabic, it's also formula or recipe. Huh, that's interesting. There are a lot of similarities between Arabic and Spanish, and also I think Filipino. I don't know if someone speaks Filipino here, but okay. So, well, of course, avoidance of slangs. They use fewer contractions instead of don't, do not, are not instead of aren't, etc. And also it's not here, but the ain't, AIN apostrophe T, the ain't is people think that this is very informal language. So obviously you will not see that in a medical paper or a thesis or something like that. There are complex sentences with several clauses and very long sentences with very different clauses. And this thing about clauses and complex sentences, this is really important because as an interpreter, when you are listening to the person who is talking to you, you are analyzing the speech. So if you use these characteristics as memory cues, like, okay, this person used an acronym, so, or this person used a word or of Latin origin, so maybe they are trying to sound more formal, because as you are interpreting, taking your notes and everything, you're thinking about everything that you are processing the message. And knowing to identify these characteristics as you are interpreting will help you to grasp the message better, or at least the sense of the style in a way that is conscious, that is not only, oh yeah, that's formal because it sounds like this in this way, but this time you know why it sounds that way, so it can help you to be more confident and have better translations. And of course, and will help you again to adapt the register. Did someone want to say something? Because I think someone was going to speak. Okay, nobody? Okay, so types of register. The consultative doctor patient, this is the type of register that will, like, by default will be the patient, the doctor's visit register. But remember that we are switching back and forth, because sometimes doctor is formal, patient is informal, so code switching. And of course, and then there is the casual register, and this one may include it's informal, it's conversational, it's like you're talking to a friend. For example, when you are with sometimes there are counselors and clients or their patients that have been a long time together and they know each other. And I even had one counselor that said to her patient, when you leave, when we finish our program, I'm going to cry. That they became sort of friends in a certain way. So you have to also, in the way you are interpreting, you have to show that that casual register. So it may include slangs and colloquialisms, and there is a very important difference between slangs and colloquialisms, and it is that slang is the informal use of language by a specific group of people, like teenagers, or maybe there are some stereotypes associated with the slangs, like if you say something this way, you belong to this type of group. So there is that. That's why slang is slang. And a colloquialism is more informal. It is used by everyone, ordinary people, and it's not necessarily offensive. It's used in everyday speech. And Oh yeah, thank you. I didn't know that you couldn't do that. Well, slang, because it's the concept of,
That's a good tip.
yeah, thank you. So yeah, so a slang singular may be a more rude than a colloquialism. It can be offensive. Okay. So intimate, private, family members, okay, and so on. And this is important, you know, even though you obviously will not like be in an intimate situation with a client, obviously, but sometimes you will have to say, oh, this person, my husband told me this or this. And sometimes when patients quote other people, you have to interpret that, but you don't know the situation in which that person told that to her. So you have to be, I guess, to imagine what they meant then, but you weren't there. So you have to try your best to match the register. So when do interpreters use these registers? All the time, like I said, because we are switching. In a same conversation, you may use different register, because sometimes I notice that patients, especially Spanish-speaking patients, want to talk a lot, and want to talk about everything. They want to tell you a story about their lives. And the doctor really is not into it. He just wants to just tell you yes or no answers, and so on. Slang is a French argot. Interesting. Okay, so of course, doctors, most doctors, they try to speak in lay terms. They don't get overly complicated with the medical terminology, but sometimes when they are, for example, giving a diagnosis, or explaining a patient how to use a device or something, they get sometimes a little bit technical and high registers. And also sometimes patients call the name body parts differently than doctors do. That's why you have to be familiar with the different ways, because if there is a communication problem, then you can, in some way, you can be aware of that problem and try to bring it up as a issue, as a linguistic issue that's happening. And yeah, so you have to be like a chameleon. You have to adapt to your environment, to the context you're at. You have to be really, you have to always have that in mind when you're interpreting, because like I said, you are not only translating words like a robot, you are thinking about what you're doing while you are doing it. So you have to bear this in mind all of the time. So these are some tips that I created. So you have to always, when you hear a word, always make sure you know not only the translation and meaning, but also the context that that word is used for. So you never assume, because sometimes something might sound in a certain, oh, you have to go, Israel? Oh no, but we are going to play a game. Well, that's fine. Thank you for coming then. So yeah, ask Google, a colleague, a native speaker, an expert, anyone. But if you're with a tricky word, especially one that is very like idiomatic, try to always get their meaning in their context. Okay, so learn different register for the same word or phrase, so that way you are prepared in case somebody tells you something very informal or an idiom or anything. And I always think about the context and the purpose of the speaker words. What do they want to accomplish? What are they saying, what they're saying? And you try to mimic that same effect, like the same impact that it will have in their own language, to have it in the, when you translate it in the other person, or at least what is expected. And also something that might be offensive, formal, informal in a language may not be in another language, even region, country. And we will be getting this PowerPoint. Uh, I will let you know. Oh, this was a private message. I'm sorry. Okay, I will let you know, Heather. And okay, so even sometimes some things may mean different things. For example, here in the Dominican Republic, we say guagua. This is like a bus, but it is the informal way of saying a bus. But also guagua is the informal way of saying, of calling a toddler or a baby. And you see, you have to be familiar with this. Like guagua in South America means something, and guagua in Central America or the Caribbean means something else. So you have to bear like the geographical context in mind as well. Or even the words tomar y coger. I know many people know that difference of one can mean like can have a sexual connotation like coger, and then tomar can mean different things. Like I think there is a map where coger means algo, something sexual, and the countries in which it doesn't mean something sexual. So you have to be always aware of that context, and you always have to try to match the registers in the source language as well as in the target language. Remember that sometimes a word like just plain translation without thinking about it, without anything, may just be may have a different register than it was intended in the source text. Okay, thank you, and Hannah, for coming. Sure. So,
Thank you. Bye.
yes. Try to convey the same meaning, impact, impression that word phrase will cause is in its same language. And remember, all this, you are thinking about all this while you are taking notes and you are listening, and you have to like say it right away. So this is what you really have to put into practice. Some of this is like preparation. You have to be prepared before, and some things you have to apply like live in the moment. Okay, so now we're going to play a game about registers, okay? So let me explain to you how is this game played. So we have slang, colloquialism, and high register, right? You can see like hypertension, and I have the Spanish translations because that's my language, but it's valid for other languages. What I want you to do is that, I don't know if someone can, it will be in the chat, or you can turn your mic on. So I want you to tell me if you can come up with the colloquial version of what you think is the colloquial version of hypertension. If you can come up with a slang, that will be great, because I don't like, I don't have that slang, but maybe there is one. You know, you cannot know all slang and all colloquialisms. So anyways, who wants to go first? Maybe you can write it. What do you think? Yeah?
Slang.
Slang? Yeah? Did you want to participate?
Yeah, but I was just testing my microphone right now.
Oh, okay. Okay, well, very well. Okay. So I think I said slang again with an S at the end. Maybe you were correcting me. I'm sorry about that.
Oh, that's okay.
Yes. High blood pressure, and in French, tension.
Tension.
Oui. Okay. Let me show you. High blood pressure. Yes, that's right. Let me uncover this. Yes. Presión alta. Yes, that's right. Okay, now, can you tell me the high register version of kneecap? Can you think about it? Patella, yes. Awesome. All in English, okay? And I want you also, as we are doing this, it's patella, because the knee is the knee. And the knee and kneecap may be like closer in register, but patella is more formal. Now, so I want you, if there is some word that you do not know their meaning, you can try to find the translation, so that way it's more like a fun for you, so you learn. Okay, so trachea. What is the colloquialism of trachea? Like the normal way people say.
Can I do it?
Yes.
It's something like one pipe.
Yes, windpipe. Yes, and this is in Mexico. They say gaznate. I know this is. I'm not sure if in Mexico it's more close to a slang than to colloquialism. Maybe someone from Mexico could tell us that. But yeah, trachea. Okay, so let's see who can come up with a slang to get pregnant. I know there are many slangs. Slang. G.
Knocked up?
Yes.
Yes.
Up is a good one.
Yeah, knocked up and up the duff. I found that one the other day. So let's see. Yeah,
How about a bun in the oven?
a bun in the oven, maybe. Yes, I read that one as well. There are many registers for that. A bun in the oven. Yeah. So what would be the high register for to get pregnant?
Conceive.
Conceive, no.
Conceive is it's like
Giving birth.
yeah, giving birth.
No, it's becoming
No.
pregnant.
Okay,
Conceive is to become pregnant.
Yes.
it can be that. Okay, let's see what I to
That's-
gestate.
To gestate. That makes sense.
Yeah, to become impregnated. Okay, so what about sternum? Expecting as well. I try to match like if it's a verb, I try to find a verb as well as much as I could. If there is no verb available for that high register or slang, I try to find the closer, but I try to keep it within the same category. If it's a noun, that is a noun as well, or if it's a subject, to keep it like, but it's not absolutely necessary. Like the important thing is the meaning. But either way, sternum, chest, but sternum. Oh, I said that before.
Yes.
Yeah, chest bone.
Chest bone.
Breastbone.
I
Chest
said
bone.
no, it's breastbone.
Or breastbone. Breastbone.
Yes.
But you explained it as chest bone.
Yeah, but chest bone. I'm sorry. I was just giving an example of a literal translation in
I know it.
Spanish.
I
Yeah,
can see.
yeah. So okay, good. So voice box. What will be in a high register?
Larynx.
Okay, let's see. Yes. Okay. Shoulder blade.
I know this. Oh my God.
Come on. Yay, Nancy.
Yeah.
Scapula.
Yes, that's right. Okay, there is another one. Okay. Holes in the nose.
Nostrils.
Yes. Yes. And do you know how to say it in Spanish? Is that your language?
No, it's not Arabic.
Fosas nasales.
Yes, fosas nasales, but you will find out that you can say narina. Who would have thought? Okay. Are you finding the translations in case you don't know it, maybe for the beginners? I hope you are. Okay. So high register for skull.
Cranium.
Cranium.
Yes, cranium. And something that I didn't mention earlier is that as informal language, you have Latin and Greek roots, right? Closer to that Latin and Greek roots. But in informal language in English, it's closer to Anglo-Saxon and Germanic roots. So that's why the differences. Okay, now who can say this high alopecia areata?
Is that the hair falling?
Yeah. Hair falling could be like a colloquialism, but there is another way of saying it as well.
Bold.
What?
Baldness.
Boldness, yeah.
Okay.
Yes. Okay, what would be a slang?
Losing your hair.
Losing your hair, hair falling.
That's it.
Baldy.
What? What was that?
What's up, Baldy?
An
Baldy.
adjective. Call him baldy.
Yeah, balding. It could be balding, pelón in Spanish.
Chrome dome.
Oh, yes.
Pelón.
Oh, yes. But Baldy is also good. It can work. Laura Huaman raised the hand. Okay, Laura, go ahead. Laura?
No, sorry, I made it accidentally.
Okay, okay. And what about avian influenza or avian? I'm
It
not sure.
could be maybe
Bird
Pilar.
flu.
Blue.
Yes, bird flu.
Yes, the bird flu.
Yes, awesome. Oh, thank you, Bia, for coming. Thank you. Okay, so let's, the next one, breast augmentation. Slang?
For English slang, I'd say breast implants.
Yeah,
Breast augmentation.
Yeah, or
but,
you
but
can
this
say
is like,
boob job as a very low slang.
Yeah.
a boob
Yeah.
job.
Yes.
Yeah.
Yeah, what would be the high register term?
Implant.
It's like the surgery, right?
I think.
Okay, I'm going to show it. Oh, there's a, oh wait, there is somebody writing
Oh,
on
good.
chat. Okay, there we go. Mammoplasty, yes. Yes,
Oh.
that's right. Yes, augmentation mammoplasty. Okay, umbilical cord.
Belly
Navel.
button.
Placenta.
The placenta is not the same as umbilical cord.
Oh, same.
Navel.
Yes, belly button, navel. Yes, actually, you know, button.
No.
One would think that belly button is more like a slang, but it has been so. I think everyone uses belly button, so it could be perfectly in a colloquialism, I think. Okay. So abrasion.
Scratch.
Bretch?
Itch.
A scratch.
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 Yes,
Yeah.
a scratch.
Rash.
Like a scratch, a graze.
Reaching.
Oh,
Yes.
Scratch.
Yeah. Okay, now let's see abs. Abs in high register slang.
Pectoral muscles.
Six
What?
pack.
Yeah. Yeah. And the high register? But who said abdominal muscles?
No, pectoral muscles.
Pectoral. But pectoral, I think, is the upper part.
Yeah, the
Is it?
chest.
Yeah. But and the abs is down in the belly.
Oh yeah, mainly right there.
Okay. Abdominal muscles. Yes, abdominal muscles. Okay, the last one. Heroin, the drug.
I think a slang term in English would be smack.
Maybe, I'm not sure. I mean, there are many slang terms for heroin and drugs, definitely, right? So let's see. This is in the Dominican Republic, and Chiva, I think it's in Mexico. Is there any other slang term for that in your country, maybe, that you know of? Well, I'm not saying that. I'm just asking. Okay.
I've heard the term dope, which that actually could be confusing. If a patient said dope, it could be several different types of drugs. So that could, might present a problem in a medical situation if you interpret it as marijuana or heroin or something else. So that's interesting.
Because dope is like the slang term for drug. So it can be any drug.
Yeah.
Yeah, certainly. So what would be the high register? I think this one is hard because nobody says it, but you know, it's good to know the information. Diacetylmorphine. Yes. That's the name, but nobody calls it that way. Just so you know, maybe in a translation comes up or something. Okay. Bag of waters, La Fuente. That's for the women.
Bag of waters.
What is actually the bag of waters?
Does it have to do with the pregnant woman?
Are we talking in pregnancy?
Yes, this is exactly. This is in pregnancy,
The
pregnant women.
The amniotic fluid? Amniotic fluid?
Yes.
Ah, yes.
Yes, that's nice. Okay, to vomit.
Throw up?
Yeah, it could be throw up or puke.
Yes.
Puke, yeah. Yeah, that's slang.
Yeah, and the high register. This is a Latin term, I think, Latin Greek term.
Regurgitate as well?
Oh yes, that could be. That could be.
That's a verb. Yeah.
Yeah, but I use a noun, so yours is better. Regurgitate. Okay. Okay, psychiatrist. What's the slang term? This is a lot on TV. They use this a lot.
Shrink.
Oh, okay.
Yes. Yes, shrink. El loquero. Okay. Okay, cool. To have diarrhea.
In Spanish it would be estar suelto, but I don't know in English.
Yeah, you can say that. You can say in Spanish, but in English it could be to have the trots, to get the runs.
Oh, okay.
This is in the Dominican Republic we say that. So yeah. Okay, let's see. Upset stomach, indigestion, high register.
Nausea?
Nausea not necessarily is indigestion.
Okay.
Indigestion is in the stomach, right? Okay.
Is it dyspepsia? Oh, there you go.
You were going to say it.
Yeah.
There's dyspepsia. Dyspepsia.
Dyspepsia, yes. Okay, high registers. This is malocclusion. This is when your teeth are. This is for the teeth. Crossbite. That could be, yes. That's a good one. Crossbite. I use crooked teeth. Yeah. But crossbite, I think, is the vomiting isn't the same as regurgitating. Really? Why?
Does regurgitating involve more spit or?
Okay.
Can you hear me?
Yes, we can.
Okay.
What's the difference?
Well, vomiting is, it says ejection of contents of the stomach and the upper intestine, okay? So it's the ejection of the stuff in your stomach and upper intestine. While regurgitating is the ejection of contents to the esophagus, only to the esophagus. So it's like only up here. It's not, you don't take them out of your mouth, I guess. The esophagus is, yeah.
Oh,
I know the animals.
I think
animals do
also,
this more.
in addition,
Regurgitate.
regurgitation is passive as well.
Okay.
Vomiting can be active and or passive, but regurgitation is passive.
When we use regurgitate, we use it for like birds. You know, they regurgitate
Yeah, exactly.
their food.
And animals, a lot of animals do that too, yeah.
So I think there's a purpose. I think there's a purpose to regurgitate.
Exactly.
Yeah, it's
Exactly. They
like
bring it up for the young. They want to feed their young, so they regurgitate the food up and they feed
Yeah,
their.
they don't throw it up. That would be informal or slang.
yeah.
So that would be vomiting is different, yeah.
Regurgitate will be like vomiting inside your mouth, like, but you don't really. It's not out of
But
your.
it's a different process. It's a different process. You know,
Regurgitate,
vomiting,
we
you're
use
sick.
we
and
use
so
with words too, like people that just listen and then just repeat what they said. They use
Yeah.
regurgitate.
It has many different connotations. Yeah. Okay. Heartburn is good for slang. Well, I don't think heartburn is not a slang. It's more like a colloquialism, I think. Isn't it? What about the native English speakers in here?
Heartburn, common.
It's very common. Yeah.
That's 99%. I would know. Doctors would know the other pronunciations and meanings.
Yeah.
Are we looking for the formal or high register for heartburn, or just whether this is?
No, it was just a comment. We just completed the game. So thank you for completing the game with me. So now I have an announcement. I know that there are some people who are members in my website and others who aren't. But yeah, you see this game we just did about this this low register, high register, I create a lot of games like this. We play Jeopardy, we play quizzes, we play a lot of stuff with the members of my website. And I'm going to organize a championship. I don't know if somebody would like to participate in that, but it basically what it consists of is that you're going to compete against, with other interpreters, and we are going to meet. We usually meet twice a week, but one of those days is going to be dedicated to the competition. So in 1 month, we are going to complete several different activities like the ones we did now, but there are like games, and the person who wins we're going to assess memory retention. So you're actually going to interpret it, and we will evaluate you. We will see how your consecutive interpreting skills are, medical terminology, code of ethics, like multiple choice questions, idioms, and register like the ones we did, and note taking. And yeah, it's going to be like activities. And the person who wins is going to, of course, have a lot of fun and learn a lot. And also this person will win 2 scripts. These scripts are scripts that I create, like medical. Can you show the first bit of the game again? This one? Do you want to take a screenshot? Yes, okay, that's okay there? Okay, yeah, sorry. That was Karen, I'm sorry. So as I was saying, yes, so you get the chance to, I create scripts. And my scripts can be anything from really simple to really complicated. So I create a situation like a role play, and you get to practice with that. For example, the other day, we were playing Jeopardy, and a girl won, and she told me she wanted me to write a script about an obese patient getting an MRI. So if another member asked me to write a script about the Tempe syndrome, which is a very rare syndrome that she had to interpret for once. So then I will create this script, I will record it and everything, and then you will be able to get it for you. So you can practice that specific topic you want to know more about. So you have like a format and a dialogue to practice actual interpreting. And also for the members who are in the group, I want to remind you that we have a book club, and we are reading Note Taking for Consecutive Interpreting from Andrew Gillis. Okay, so we are reading this book, and please finish. We will discuss at the end of the month, at the end of August, we will discuss this book, and we will make like a presentation just like this with the most important points, the topics we found the more interesting, and we will talk about it, and we will learn from that. And also the championship is going to start in September, so you are able to get prepared for that, because it's going to be really competitive. Okay, and then tomorrow we have another Zoom meeting at 9 a.m. and we are going to talk about techniques and strategies to research and translate medical terminology into your target language. So how to do research on which pages, how to what process do you follow to find correct translation, like come up with your own translations. And we will practice, of course, and play games tomorrow, but that's for members only of interpremed.com. So now we are going to actually practice, and this is like the most important part, because we're going to apply everything we talked about. Okay, so I'm going to send you this document. I sent it at the beginning. Yes, Alexa, note taking for consecutive Can you please write the name of the book? Okay, Alexa answered you. What was your page website, please? Okay, yes, I'm going to send it to you now. Interpremed.com. And in my website, I have many games like this. And let's see. Okay. So let me send you this link. Can you share the link to the book club? Oh, the book club, you can join my Facebook group. And we do a lot of activities in the Facebook group. And that way, well, most likely all of you are there already. But I publish different activities in there, and there are people who are in the Facebook group who aren't members, and they complete these activities and they participate in the Facebook group. And but the discussion at the end of the month is going to be for members only. So yes, so did you open this page here? There is
Okay, you should. There you
this,
go. Oh, that's the Amazon.
I sent you, that's the Amazon. Yes, it's available on Kindle, so you can read it anywhere. It cost about, I think, like about $7 or something, or no. It was about $35 in Kindle, but it's a really good book. I'm really enjoying it, and I have read like 27 pages. Really cool stuff. So yes, have you opened this document? You are able to see it, right? Yes, I can see all of you are here. So yes, here are the links for practice. Okay. And these are level 1, level 0, etc. These contents, I usually have it only for my members, but today is like an open house. So maybe if you want to access all the contents, you will have to register for the membership. It's $5.5 per month, and it's paid through PayPal. You can cancel anytime, and all of this is what it includes. And I have shared a link with you, and you will be able to access all of these exercises for today. So if later you want to review it more slowly and calmly, that's fine. But yes, so now I'm going to split.
Are you going to share that, Doc?
I did. I just sent the link in the chat. Were you able to see it?
No, I see the Amazon one.
Okay, I'm going to send it again. It's Google Docs or Docs Google.
I may be wrong, but I'm looking.
Okay, so everyone is able to see this document, right? To access all the links.
I just see the Amazon one. You said it on the note with the chat, on the chat?
Yes, open the chat, and in the last link, it is, yes.
Yeah. There's Amazon, and then somebody said, thank you, I have to leave.
Yeah.
And then somebody said, I don't see it in the chat.
Oh, I'm sorry, I'm sending it privately.
Okay.
Wait, let me tell it to everyone in the meeting. Yes, there you go. Now you can see it. I'm sorry.
Yes, thank you.
I'm sorry, I just, yeah, Zoom. Okay, awesome. But we have still 2 hours, so you have a lot of time.
Okay.
I'm curious if the Spanish spoken language interpreters sometimes match the consultative register of the provider, then also add a lower register term immediately following. No, I mean, you want to be accurate. If you give 2 translations for 1 term, you are like adding explanations that aren't really there. 195142121. I'm sorry. Okay, anyways. So yes, Nancy, in Spanish, in spoken language, we, at least myself, because it depends on your company's or your agency's policy, they have their own like, let's say their code of ethics, how you should do things. In my company, in my personal preference as well, I don't try to give 2 translations of 1 term. I just say 1 term, the best possible translation that matches the same register of the speaker, whether it's formal, informal, or whatever. It's not your responsibility to adjust the register. It's the providers or the patients. Those are their words, not yours. So you cannot edit them. If you like to talk, if you like talk to a baby, what type of register is that? That would be, let me see, because the scale that I gave you is just one of many scales. So maybe to a baby, what would you talk to a baby? Baby do not speak. So
no, like I said, like because I asked you that question on the group, like, okay, when you're saying wawa, we say to a baby, like, let's say mama, wawa, baba, like just very, very, very simple words.
Yeah.
So you would never say that to a grown up or to even like, it's like, it's really baby talk, like they say in English, baby talk.
Yes, it is baby talk, but
is that registered or it's not even a register? I mean, would that be a register? Does it have a name or?
Let's see, we have frozen, formal, informal, casual, intimate, consultative. I think it will be more in the informal language, certainly. Because wawa, you can say, oh, I was with my wawas You know, my Wawas were doing this because a Wawa is like a toddler, like a small children of 5 years of age.
Really?
So,
You say that in Spanish?
yeah, it is. It is, I think, in South America, in some countries of South America. Yes, and I think, yeah.
So in Arabic, you would tell a baby, like if you're talking to like a child or a toddler, and you want to tell them, "Are you hurt?" You would say, "Do you have a wawa?" Wawa means, "Are you hurt?" But you would never say that to like even even like a child, a child maybe. But I just thought that register it had a name to it. So I was just wondering. I mean, when you talk to really low, like you're talking to a toddler, like you're using very very simple words.
Wawa is not a verb, and it's not a way of addressing someone.
In Arabic. We use it in Arabic.
In Arabic, okay. So
Yeah,
it's like a way of addressing someone like you, they, them. You say wawa like a way of addressing someone else.
If you're a baby and you hurt yourself, so you go to the baby and say, "Oh, do you have a wawa?" Wawa in Arabic means,
yeah.
"Oh, you hurt yourself." So I was just wondering, is this register when you talk to just in any language? I mean, any language. When you talk to a baby in a very very low register, does that have a name? This type of register. I was just wondering, because actually when you talk to a baby, it's different than when you talk to, like informal or formal or whatever. When you talk to a baby or toddler, it's really really going very low.
I think it would be intimate, like the type of talk you have with your family or like your close friends.
Yeah, it could be.
I don't know. In Arabic, it's different, maybe, because we use such words for babies, and then when they grow up, that's it. When it's like, these words aren't used anymore. It's just when it's like really a baby, a toddler. So just saying simple words. I actually don't like that way. I don't like to talk that way. With my child, I never use it because I just like to say the word from the very beginning, and that's it. I don't like to use the very simple words. It's just for me, I don't like it. But a lot of people use it. A lot of people when it's a baby or a toddler, they use these very words that you don't use it when you're grown up at all. You just don't use those words. So I was just wondering, if it's the same,
Yeah, remember that we talk about that register is a spectrum. Like not everything can be fit within one classification of register. It's like a spectrum. Sometimes some things are just less formal, more formal.
Yeah, so I guess it'll be informal then.
Yeah, it will be more informal. Yeah, that's really interesting. I learned a new Arabic word. Okay.
Yeah.
Okay, so let's go. I'm going to split you in breakout rooms, okay? So what I want you to do is that I want you to say your language in the chat box. And then I'm going to create a room and put you with the same speakers of your same language, okay? So let me create the breakout rooms and just send it once so I can see all the messages. Just one time is enough. Okay, now allow me just a few minutes while I'm creating this. You can, in the meantime, while I'm creating the rooms, you can review the links. All of you have access to the link, right? To the document.
Yeah.
Which document? You mean
the one, this one that I have open? I want you to all, because they're going to use this, and I'm going to, let me explain to you first how we're going to use it, okay?
Okay.
Because sometimes it can be very confusing for some people. So here is the practice, right? This is a strep throat. This is level 0, which is like a level to prepare you for the upper levels, right? So you have a side translation. Usually you do this alone in your own time, but we are going to do it. We're going to do a translation together. We're going to interpret together. So these are the audios. And here is the script of that audio. And what you can do is that you are going to read, this is English Spanish, but there is also an English neutral one, which is everything is in English. And if for example, if you're a pair of people, you're 2 people, one person is going to read, "Hello, I'm Dr. Jones. What brings you and this cute boy to visit me today?" And then the interpreter will interpret. and then the other person will read the script, and then you are going like back and forth reading. So how can you organize? It can be one person that reads the whole dialogues, and then the another person is there are one interpreter, one doctor, and one patient, and there can be one person reading the script, and then there is the patient. The one interpreter is going to interpret what the patient says, and the another interpreter will interpret what the doctor says. So you get the idea, right? It's very, you can like arrange it as you think is more convenient for you, depending on how many you are. But the idea is to read the script. The other person will read the script to you and will interpret, and just so you will be in the same language, this person is going to give you feedback. And this feedback is going to be based on this feedback form, okay? It's going to be based in this. You're going to listen to this person, and then you're going to say, okay, this person omitted this or changed this, or and the medical term wasn't correct, because you both are going to speak the same language. Is that clear, what you're going to do? Really clear, right?
So you're gonna, after you're gonna put us into groups, right?
Yes, I'm going to break you in groups, in breakout rooms, and it's going to be, let's see. Okay, now I'm going to assign you to the rooms. Okay, so let me see. Let's start with CRB. She was the first one. Okay, so she's Arabic. Her language is Arabic. So I'm going to create Arabic room, right? And I'm going to do this in silence, and you can review the links that I just sent you. Everyone has access, right?
Mm-hmm. Yes.
Okay, so you can calmly review that, because it's going to take me a few minutes to split you in the rooms. But everyone, if you haven't sent your language, please send it in the chat. Okay, thank you. Allow me one moment. And those who are at work, or who are, I don't know, who cannot interpret, or maybe are afraid to interpret, or don't know anything, you can just be like a listener, like how do we say this?
A
Like
witness.
Yes, you can be just the witness. You can just be like a
An observer.
An observer, yes.
Yeah.
You can be just an observer or a witness or whatever, but you're going to be there just listening, and you can jump in the different rooms with the different languages if you are an observer. Okay, if you want to be an observer, you type observer, and then I will assign you to your specific room. Okay,